contracting a blood-borne disease such as AIDS has caused some people to overreact, leading to some awkward and embarrassing situations. The chance of contracting a blood-borne disease in a school environment, while minimal, is still possible. Your job may require exposure to blood on a regular basis. Or if you are a teacher or a custodial worker, you may be exposed only in rare instances. But because of the potential consequences of blood-borne pathogens, it is important that everyone has an understanding of these diseases and how they can be transmitted. Risk of infection with these pathogens can be reduced by compliance with the recommendations of the Occupational Safety and Health Administration, or OSHA. In this program, you will learn about the important diseases associated with blood-borne pathogens and their respective symptoms, how these diseases can and cannot be transmitted in the workplace, proper procedures to prevent exposure, and steps to take if exposure occurs. Blood-borne pathogens are microorganisms that cause disease. They are found in blood and blood products and other bodily fluids such as semen, vaginal secretions, and breast milk. They may also be present in tissue cultures, organ cultures, and experimental animals. The two most prevalent blood-borne diseases are hepatitis B and the human immunodeficiency virus, HIV. Although HIV is more publicized, there is a greater prevalence of hepatitis B in students. Hepatitis B is an infection of the liver caused by a virus. Reaction to the virus differs from mild symptoms that resemble the flu to more severe symptoms such as a lack of appetite, dark urine, jaundice, nausea, vomiting, diarrhea, and in extreme cases, death. In fact, 5,000 individuals die annually of hepatitis B-related illnesses. About 1/3 of those infected with the virus may show no symptoms. Up to 10% of infected adults and a greater percentage of children become chronic carriers of the virus. These individuals, while appearing healthy and normal, are contagious and can infect others. HIV infection usually progresses to AIDS. The initial infection is sometimes characterized by the development of a flu-like illness which then resolves. However, the virus goes on to attack the body's immune system, making the AIDS patient susceptible to many types of diseases, including certain forms of cancer and infections such as pneumonia. Situations in which you could be exposed may be infrequent, but must be recognized and handled appropriately. Do any of these following scenes present a situation in which an infection from a blood-borne pathogen could occur? Could the professor be exposed? Is this a means of transmission? Could the school nurse be exposed? Blood-borne transmission of hepatitis B and HIV can occur only if the source blood is infected, and that blood finds a direct route of entry into the body. The routes of entry include breaks in the skin, such as a cut, scrape, dermatitis, or acne, splashes into body openings, such as the eyes, or penetration into the skin by a sharp, contaminated object, referred to as the parenteral exposure. The concentration of hepatitis B virus is much higher per milliliter of blood than HIV, and is therefore 100 times more contagious. The increasing incidence of AIDS has caused fears that have developed into misconceptions about the disease. HIV and hepatitis B are not transmitted by casual skin contact. They cannot be spread by the sharing of food, drinking glasses, or towels. They are not transmitted by coughing or sneezing. In the first scenario, there was a potential of exposure because blood was present. In the second scene, there was no chance of transmission, since the fall did not cause bleeding. In the third scenario, because the teacher's and the student's skin were punctured, there is a chance of transmission if either person is infected. However, risk of infection can be reduced by implementing the precautionary steps mandated by OSHA. Situations in which you could be infected if the proper precautions are not taken include a puncture in your skin by picking up contaminated sharp objects or glass, touching infectious blood with exposed skin that has dermatitis or cuts, or contact with improperly disposed of contaminated material. The safest approach to handling blood or other potentially infectious material is to take universal precautions. This means that all blood is treated as if it were infectious. For instance, first aid respondents must wear gloves to prevent exposure to blood-borne pathogens. Protective equipment acts as a barrier to infection. Gloves must be worn when there is any hand contact with blood. Before putting on the gloves, check for holes, tears, or punctures. When removing potentially contaminated gloves, roll up the end of the glove inside out. Once the other glove is removed, there is a clean surface for the unprotected hand to remove the contaminated glove. Hands must be washed immediately after removing gloves. Never wash or decontaminate disposable gloves for reuse. Hypoallergenic gloves, glove liners, and powderless gloves are available if you are allergic to the gloves normally provided. Spills of blood or other potentially contaminated materials must be cleaned up immediately. When cleaning up a spill, wear full personal protective equipment to prevent contact of infectious material with any part of your body. The greatest threat of exposure to blood-borne pathogens in the work environment comes from punctures in the skin from contaminated sharp objects. Always use mechanical means, such as a broom and dustpan or tongs, for picking up broken glass. Bring the trash receptacle toward the broken objects, instead of carrying broken glass across the room. Vaccinations are available to prevent hepatitis B. The vaccinations are given in 3 doses over a 6-month period and have proven to be over 90% effective. If you are likely to be exposed to blood and other potentially infectious material as a result of your work-related activities, this vaccine is available to you free of charge from your employer. If exposure occurs, immediately wash out the potentially infected area. Then report the incident to the proper personnel trained to initiate the proper procedures. All medical records are kept confidential. If you have not been immunized against hepatitis B, you can receive the vaccine at that point. It is important to report the incident right away. Although some jobs have a greater chance of exposure than others, everyone must understand the diseases and the modes of transmission. One exposure could lead to a life-threatening disease. Recognize situations in your work environment in which exposure could occur. Follow the established work procedures at your school. Know when and how to use the proper personal protective equipment. Use universal precautions and make sure you ask about vaccination against hepatitis B. By understanding blood-borne pathogens, you can achieve a balance between overreacting and developing the proper respect that will prevent occupational exposure to blood-borne pathogens. Brought to you as a service of SmithKline Beecham Pharmaceuticals.